Welcome to the 19th week of pregnancy. You are almost halfway through, your belly is emerging. Did you know that the shape of the belly has nothing to do with the sex of the baby? Contrary to what we always believed, right? The size of the belly or the shape of the belly? If it is round, it has a lot more to do with the position of your baby, with genetic factors and even fluid retention. But do you want to know how your belly is, or is it size the uterus, changes in your body such as coloring, in the cheeks and even in the lower parts such as, is yours? Baby size weight news. Stay with me and I'll tell you. Hello, I'm Monica Romero. I'm very happy to have you with me. Thank you, man. Love, so nice to participate in this whole wonderful phase with you. And I already want to tell you about you. Did you know that your uterus has already expanded so much that it is already at the height of your belly button? In other words, goodbye waist. But calm down, it's just for a while, okay? After childbirth, after a little while after childbirth, if you're not one of the very privileged genetics, your waistline will come back. And because of this uterine expansion, your stomach now starts to flatten out. There's no room for him. And along with pregnancy hormones, there is also relaxation in our intestines. Our entire digestive system is compromised. What are we going to have? Slower digestion. Soon we end up having more emptiness and more reflux. With this happening, it's best to avoid liquids. During the meal and some more spicy foods. Spicy. Too much tomato sauce doesn't work very well either. Fried foods, these junk foods, fast foods. They are the worst at this time of management. It doesn't help. So, light meals with fewer quantities, more times a day, can help you get rid of a little of this heartburn discomfort.
Anything else?
What's happening to you?
I've said too much.
Hear about increased blood flow. So I will talk again because increased blood flow is one of the things that most interfere with our body. Give me that super sense of smell. It can also move our eyeball, leaving our myopia or stigmatism or farsightedness. It's a little different. It also changes. Sometimes it causes a little blocked ears, a constipated nose. It makes our veins more apparent. And with the circulation increasing, we can start to have a darkening of our vulva. It can have more apparent veins. Or can she? And getting more purple, which is called a crush sign. This tightening of the vulva, it tends to improve much after childbirth. Most women will have normalization of this region, but some others, they may have a deposit of hormones there, even more accentuated. And even after childbirth, it will not disappear. It will soften, but it may not go away. This can happen not only in your vulva, but also in your armpit as well. You can. And I'll tell you a secret. I had to do a laser to lighten it. I had this tightening, this darkening of my armpit and vulva, including in my groin, that little patch with my thigh. And I had to resort to the laser to be able to remove it. And I went to laser a short time ago, okay? So it was more than 10 years since my birth, right? Still, she's not gone. But no.
Are you worried?
It's your body working to generate one of the most extraordinary things that's going to happen to you. Another significant occurrence is how our mammary glands work hard to start producing colostrum. You may have some sebaceous glands that sit around the nipple there. Flames, Montgomery glands. Look what a difficult name I will leave written for you. To make it easier, it's the sebaceous glands, and they can have an expansion. Some women already have these glands themselves even before they become pregnant. Others will appear only during pregnancy. There's no case that doesn't even show up, okay? Don't press, don't move.
Let it go.
Quietina is just a sebaceous gland. No milk will come out there or anything. Just don't move it. Leave her quiet so she doesn't get an infection or inflammation. That's all right. Also, due to hormones, we are having a darkening of our areola, which can even look as if it were a second areola. It will grow a lot. It will darken and grow. All this to increase the contrast and make it easier for our baby to find where his bad one is.
But how?
Our body cannot focus this melanin hormone just there in the breast, and it goes to the entire body. So there are greater chances of melasma, which are those spots you have, especially on your face, right? So always use sunscreen. It helps a lot to prevent melasma. If you have some genetic factors that may increase your chance, keep using sunscreen, because even then it will help you have lighter spots or spots that will disappear after childbirth. Spots can appear in other areas of the body as well, but are more common on the face. And in addition to these spots, we also have to talk about stretch marks, right? Are you applying moisturizer properly? Even more important than moisturizer is that we hydrate ourselves from the inside out with liquids, drinking water. It's very, very important. And remember, okay, soda increases the likelihood of stretch marks, so stay away from them during pregnancy, especially because they don't even enter our liquid bill, because they have many, many other chemical components, including sugar or aspartame. We don't put it in our liquids account, okay? So you have to drink water and you have to hydrate yourself, so we can try to escape this a little bit. Bear the scare of pregnancy. But that's also nothing for the time of death, huh? If it happens to you, it's not to cry. Remember that you are doing a very important thing. Now you are doing eyes, you are doing liver, you are doing kidneys, you are doing heart, you are producing so much that it is obvious that sometimes our body also has to show these marks of victories that it is.
Getting it, huh? This part of the...
Pregnancy is important for us to also think positively. Remember too, okay, because of your body, right? Your circulatory system is so busy and is circulating all this volume of blood inside your body to also send to your baby. It's normal for us to be a little more breathless, feeling a little more tired. So respect your body whenever possible. Rest, this will bring you more well-being and will not leave you so tired. But yes, we get more tired during pregnancy, and being able to rest, that's what we have to do.
And let's discuss your little baby, that delightful, snuggly artichoke whom I already adore.
Too much. Look, he's already measuring between 13 and 17 centimeters, weighing about 200 grams. And that measurement is from head to butt, okay? We don't consider our legs at this moment because in addition to them being bent, it becomes more difficult. We get the average right, and if your baby is a little bigger or smaller, perfectly normal. I'm just giving you an average of how he is. I had commented to you that your baby had entered a very important phase of brain development and has now formed myelin, which is responsible for the electrical impulses that will make all the difference in the baby's intellectual development. In other words, he is already getting smarter. Oh, there's too much. How cute. And with that, he already changes position. He already has a preferred position. He already responds to stimuli of both light and sounds. He is learning more every day, even inside his belly, and is already recognizing voices. He already knows what your voice is. He's already recognizing the voices of people nearby and the most common sounds you hear, such as the cat meowing, the dog barking, the horn in traffic. And when he comes to this extra-uterine environment, he will still be scared. He will still adapt because he still hears with amniotic fluid, muffling this sound, but he can already recognize several of them. Another very cool piece of information is, what about your baby? He sleeps about 1 hour at a time and spends a few minutes awake. And it is during these minutes that he learns, develops, knows, stands there testing the umbilical cord, puts his hand on his face, yawns, makes a grimace, sucks his finger. He's testing everything he has in this uterine environment to develop. And just like on this side of the womb, these moments, this hour that he spends sleeping, eSIM, he spends a lot more time asleep than awake. It is very important for him to preserve energy so that he can grow, develop healthily.
What's it like over here?
Getting enough sleep is crucial for both us and the baby, especially since he's eager to explore when he's awake and doesn't focus on conserving energy.
Yours?
Your baby is growing more hair each day.
Fluff calling?
Wool covering his little body. Most of these hairs will fall out before birth, but in premature babies especially, it is normal for us to notice that they have, especially here, the shoulder, the leg a little more hairy and will fall out a few weeks after birth. Sometimes even months, it may take a little longer, which is perfectly normal. For example, your baby is born bald or hairy again. genetic and environmental factors influencing our baby. The Vernix Caseosa, I talked about it last week. If you don't remember, take a look at the video here. Oh, it's always linked to you, but it's 11, a little greasy substance that's around your baby. It's a little whitish. Vernix is to protect you from so much liquid, right, in the uterine environment, to protect. And your little skin that is still super transparent and we can still see your blood vessels, but also post-marto. What does that mean? Before we had the habit of having a baby, it was born, we already went to that first bath, we filmed the bath, it was the most delicious and beautiful thing to see. But we ended up discovering that Vernix is super important to help the baby control his body temperature, to protect and hydrate the baby in this environment outside the uterus. And also in this adaptation, even inside the womb, out of the womb. So the recommendation today is that yes, we can dry the baby there, but he will only take his first bath 24 hours after giving birth. Useless one novelty is that if you are expecting a little girl, all the eggs she will carry for her entire life are already formed. What if it's a little boy? Now, the testicles can also be seen on ultrasound.
And what's the final piece of advice about your baby?
And of extreme importance, get a diary, pencil, paper, pen, cell phone, something not to open, okay? It's time for you to schedule your second trimester morphological ultrasound, an extremely important exam where the doctor will look for the characteristics of your baby, including if it has any risk for some genetic disease or malformation. I will link here for you a complete video in which Dr. Diego tells us everything the doctor looks for in the morphological ultrasound of the second trimester, but short for you.
Generally speaking, they will be
checked: heart, EH chambers, brain formation, baby's kidneys, digestive system, location of the placenta. To see if there is any risk of placenta previa, I leave a video for you here also about placenta previa, but I'm going to leave a summary here. It's about the location of the placenta, okay? Usually she's going to stand in this higher part, as you can see here on the side, and you can have a placenta previo that she's going to stand there in Christ. But there's a video explaining it better, okay? And of course, the measurements of the little head and firm will also be checked because they will bring you a closer measure of what the size of your baby is, how much he is growing. So please put it on the agenda. Talk to your doctor that this ultrasound is one of the two most important. There is the first trimester and the second trimester. You can't lose. Okay, and you can still take the opportunity to confirm the sex of the baby, or if you don't know, you already know. I heard about Larissa in that second trimester ultrasound, you know. You can ask the doctor, and if you don't want to know, take it. The envelope asks him to put it there, hidden for his revelation tea. What about my nutrition tip for this 19th week of pregnancy?
It might be something you're not too fond of, but he is.
Very rich in iron. And you need iron because of your blood production of red blood cells. Liver, do you like it? Tell me. There are a lot of people who don't like it, and there are a lot of people who love it passionately. Of course, if you don't like liver, there are several substitutes for iron. Also, it has in red meat, it has in all these foods, which I'm passing here for you in the video. So please take care of your iron intake so as not to lack and not have anemia in your body. And my tip of the week. Look, pay attention. This is very important, okay? When you go to research your baby's furniture, you have to pay attention, especially in the crib. The gap between one piece of wood or iron and another of the crib cannot exceed 6.5 centimeters. This is a rule. It is a guideline from Anvisa, in fact, so that the baby's head is not at risk of passing through and getting stuck. She may pass and then she won't come back because he may have tilted. So all cradles can't have. Then take a ruler, a tape measure, or a measuring tape that you can take out even the paper when buying. So you do not buy a crib that is not certified so as not to bring risks to your baby. This is very, very important.
The hint number?
2. Yes, since we are talking about cradle, why are you a research? Those that turn into mini beds, they bring savings. My children used mini bed almost until 5 years ago. It was the same crib that became mini bed. It's excellent. You're going to have to change mattresses midway through because he can deform. He ends up peeing at the base, vomiting. So you're probably going to have to change mattresses midway through. But you don't need a pillow. You don't need a crib kit. Save that money. Crib kit is not recommended by the Brazilian Society of Pediatrics because it can cause choking in the baby. I'll leave a video here for you about it. So you already save on the crib kit. Invest in a crib that you won't need to spend later desperately buying a bed. Of course, if you don't like mini bed, I'm just giving you a savings tip here that you know I like to save. I think this tip is good. And when you go looking for a dresser, you can look for one that is also your changer, or that leaves everything in an easy way for you to get to change a diaper at dawn to have everything there in the way. This helps a lot in our daily lives. I really hope you enjoyed these tips.
If you liked it, don't forget to
leave a like for me, tag a baby girl, you know when you're going over there on the bus. A pregnant woman indicates her parents manic. And I thank you so much. Thank you so much for letting me participate in this wonderful phase that you are in.
Passing and me?
See you in the next video.